No, I don't wear a helmet. Not all the times.
No.
Why do you not wear it sometimes?
My hair will get spoiled and sometimes I like the cold air, so I don't wear it in the morning. Evening like. Don't wear it.
Because there is no necessity to wear it. When I have to go to nearby places, I don't usually wear it.
I don't feel like it is necessary because it feels irritated.
Do you have a phone case? Why do you have a phone case?
Obviously to protect me.
You won't protect your head by wearing a helmet? Do you have a phone case?
Yeah.
Why do you have a phone case?
To protect my phone,
So you don't think you have to protect your body by wearing a seatbelt?
I should.
Why do you have a phone case?
My phone is expensive, so I need to protect it, right?
Is your brain not expensive? Why do you have a phone case? To protect my phone. Don't you have to protect your brain? I'll wear a helmet. Start wearing one now.
Yeah,
Do you wear a helmet?
yeah, I wear.
You start wearing a helmet from now on.
Yes, I will do.
You said you keep dropping your phone. You don't think you'll fall off the bike?
Yeah.
So don't you think you need to wear a helmet?
13th February is celebrated every year as International Oral and Maxillofacial Surgeons Day. On this day, we from the Department of Oral and Maxillofacial Surgery, Sri Ramachandra Faculty of Dental Sciences, take pride in acknowledging our fraternity's ongoing achievements.
இன்று சர்வதேச வாய் மற்றும் முக தாடை அறுவை சிகிச்சை நிபுணர்கள் தினம்.
Oral and maxillofacial surgery is a surgical specialty of dentistry focusing on the oral cavity, head and neck, facial trauma surgery, facial cosmetic surgery, and reconstructive surgery of the face. We also deal with emergencies related to the head and neck region. In many ways, it can be said that it is a bridge between the medical and dental fraternities.
History of OMFS dates back to 400 BC, where Shushruta had described various surgical procedures involving the face in his work Shushruta Samhita. Over the years, oral and maxillofacial surgery has evolved to include a wide scope.
எங்கள் துறையில் மேற்கொள்ளும் பல்வேறு சிகிச்சை முறைகள் பின்வருமாறு.
Removal of impacted teeth, which is a common finding in young adults. Surgical replacement of missing teeth by means of dental implants. Facial cosmetic surgery to cater to the patient's cosmetic requirements. Correction of jaw discrepancies and facial asymmetry through orthoplastic corrective jaw surgery. Surgical management of facial trauma to restore form and function. Head and neck cancer surgery and reconstructive surgery to address malignancies of the head and neck region. Conservative and surgical management of temporomandibular joint disorders.
On this special day, we take the opportunity to remember one of the foremost pioneers of oral and maxillofacial surgery in India, Professor C.K. Dhanasekaran, who left us for heavenly abode on 13th of February 2021. On this day, we, the OMFS team at Sri Ramachandra Faculty of Dental Sciences, would like to share with you our journey. Now, here's what our patients had to say about their respective experiences with us.
So today I come to the dental department. One of the cavity is being extracted. Very comfortably they have done without any problem. I am 73 years old now. Still I am coming all the way from Pondicherry because of the hospital, the excellent with the hospital. Anyhow, I trust all you or the entire family of Ramachandra be happy and prosper in their life.
எனக்கு 15 வயசு இருந்தப்போ எனக்கு ரோடு ஆக்சிடென்ட் ஆச்சு. எனக்கு அவங்க ரொம்ப கம்மி செலவுலேயே எவ்வளோ கம்மி பண்ண முடியுமோ அவ்வளோ கம்மி செலவுலேயே எனக்கு நல்லபடியாக ஆப்ரேஷன் சக்ஸஸ்ஃபுல்லாக நல்லபடியாக முடிச்சு கொடுத்தாங்க. இப்போ எனக்கு 27 வயசு ஆகுது. இப்போ வரைக்கும் எனக்கு எந்த கம்ப்ளைண்ட்டும் இல்லை. தேங்க்ஸ் டு ஓரல் சர்ஜன். ஹாப்பி ஓரல் சர்ஜன் டே.
While the entire country was under lockdown, we as part of the medical fraternity kept our patients' interests first. Our team of postgraduate residents and consultants attended to patients 24/7 who were brought to the SRMC emergency room.
Complaints ranging from major traumatic injuries to simple toothache were taken care of, pertaining to appropriate COVID guidelines. In addition, we also attended to emergency cases which were tested COVID positive. Let us give you a glimpse into the various practices and events that our residents and students have taken part in over the month. The strength of the team is each individual member, and the strength of each member is the team itself. Our team comprises of the leaders who continue to lead the team in the right direction, the in-house postgraduate residents who strive to deliver their best versions pertaining to the interests of their patient and the department,
our nursing staff and supporting staff who are an indispensable part of our team. We thank you for your kind attention, and as a community, we are fortunate and happy to always be at your service.
எங்களது சேவைகளை மேலும் தொடர நாங்கள் பெருமிதம் கொள்கிறோம். தங்களின் பொன்னான நேரத்தை அளித்ததற்கு நன்றி.